Do you have a herniated disc and you have been told that surgery is the only option? Are you afraid to do certain movements because you think you'll make things worse? Today, I'll show you that the truth is different. There are many myths about herniated discs that you might have heard, such as surgery is the only and best option. Discs can slip out of place. I will have permanent limitations or disabilities. Movement will make my disc injury worse. Through this guide, I want to help you understand why these beliefs are incorrect and help you better understand what a herniated disc is, how this condition develops, and how to feel better. Before we begin, let me introduce myself. I am Mikkel, and I am a physiotherapist really passionate about my work. This is a truly comprehensive guide to understanding what a herniated disc is, the causes, and the best treatment for you. It took me a long time to make this video, so I ask you to please leave a like and above all to subscribe to the channel. You would help me a lot. First of all, I want to briefly explain what a herniated disc is. If there's anything you don't understand, feel free to write it in the comments and I'll try to help you. A herniated disc happens in the spine. The spine is crucial for supporting the body and is made up of stacked bones called vertebrae. Between these bones are discs, which act like cushions. Each disc has a soft, jelly-like center called the nucleus, which is mostly water, and a tougher outer ring called the annulus. The discs help absorb shock from movements and prevent the vertebrae from pressing too hard against each other. Muscles around the spine also help protect it. A disc can get damaged in two main ways. Protrusion. The outer ring gets deformed but doesn't break. Herniation. The outer ring breaks and the jelly-like center can either. The vertebrae are divided into sections: cervical, neck, thoracic, upper back, lumbar, lower back, sacral, and coccygeal, tailbone. Herniated discs are rare in the thoracic area, uncommon in the cervical area, and most frequent in the lumbar area. What causes a herniated disc? A herniated disc is the result of gradual wear and tear on the spine elements due to age, aging, and heavy work or professions. Over time, the intervertebral discs lose their water content and valuable fibers, which reduces their strength and flexibility. Traumatic or violent causes that can lead to a herniated disc include intense sports activity, weightlifting, carrying heavy objects, sudden movements like jerks and excessive twists, falls onto the back. What are the symptoms of a herniated disc? A herniated disc is not always necessarily painful. Symptoms vary depending on the age, size, and location of the hernia. Generally, they include pain, often very intense, preventing any movement or effort. Pain can occur in the legs or arms depending on where the disc has ruptured, specifically in the lower back, lumbar, or neck. Cervical. Numbness and tingling in the limbs or a feeling of discomfort. Weakness, making it difficult to move or grasp objects. If you are finding this video useful, I invite you to leave a like and subscribe to the channel. It only takes a few seconds, but it is so important to me. I put a lot of effort into making this video. Thank you. Scientific literature is full of studies showing that healthy people, without symptoms, can have herniated discs or other types of disc degeneration. What is the course of herniated discs? Herniated discs completely or partially heal in many cases. Larger hernias seem to heal better. Since having a hernia doesn't always cause symptoms, the reverse is also true. Healing of the hernia does not always mean a reduction in symptoms. What do you think could be the cause in your case? Let me know in the comments so we can think about it together. Some key points about herniated discs. In 95% of lumbar herniated discs, the L4, L5, and L5S1 discs are affected. Lumbar disc herniation is 15 times more common than cervical disc herniation and is a major cause of lower back pain. The prevalence of symptomatic lumbar herniated discs is about 1% to 3%, most common in people aged 30 to 50, with men being affected twice as often as women. In people aged 25 to 55, about 95% of herniated discs occur in the lower lumbar spine, L4, L5, and LA5S1. Above this level, herniations are more common in those over 55. If there is something you don't understand about this data, please let me know in the comments so I will explain everything carefully. Cervical herniated discs occur about 8% of the time, most often at levels C5, C6, and C6, C7. High-quality scientific studies conducted on a total sample of over 3,000 people suggest that MRI scans can produce many false positives. In these studies, healthy, symptom-free patients with no pain, no back limitations, and no history of back pain were examined using MRI. These are the typical cases of patients who would never see a specialist because they are well. And what were the results? 37% of healthy 20-year-olds had lumbar disc degeneration. This percentage rises to 80% in healthy 50-year-olds and up to 96% in healthy 80-year-olds. Again, these are patients with no pain and no back problems. Therefore, the results of an MRI can be quite relative. Some changes are part of the normal aging process of the spine and intervertebral discs. MRI is certainly a very useful tool in the medical field when used correctly. The specific cases that require an MRI should be determined through a proper and thorough clinical evaluation. What can we do to treat a herniated disc and feel better? Only a small percentage of lumbar herniated discs cause severe or progressive symptoms that require surgery. The decision to undergo surgery for a lumbar herniated disc depends on several factors, including the severity of symptoms, the response to conservative treatments, and the level of functional impairment. The percentage of lumbar herniated discs that require surgery varies depending on individual cases and conditions. However, in general, only a small percentage of lumbar herniated discs require an operation. According to some studies, it is estimated that only 10% to 15% of patients with lumbar herniated discs develop severe or progressive symptoms that require surgery. Most herniated discs can be managed with conservative methods such as physical therapy, pain medications, lifestyle changes, and other non-invasive therapies. It is important to consult a specialist doctor for an accurate assessment of your specific case and to determine if surgery is necessary. Before continuing, I would like you to let me know in the comments what treatment you have done to treat a herniated disc. Did it help you? Would you do it again? Now I want to talk about the role of physical therapy in herniated disc recovery. Physical therapy often plays a major role in herniated disc recovery, addressing various aspects crucial for effective healing and long-term health. Here are the key points that outline its significance. Pain management. Physical therapists use a variety of techniques to manage pain and reduce inflammation. This can include manual therapy, where therapists use their hands to manipulate and massage the soft tissues and joints to relieve pain and muscle tension. Strengthening muscles. A critical component of physical therapy for herniated disc recovery involves strengthening the muscles that support the spine. Therapists design personalized exercise programs that target the core muscles, including the back, abdomen, and hips. Strengthening these muscles improves spinal stability, helps distribute the load more evenly across the spine, and reduces the risk of future injuries. Exercises might include planks, bridges, and leg lifts, all aimed at enhancing core strength. Improving flexibility. Restoring flexibility is essential for reducing pain and improving movement. Physical therapists incorporate stretching routines into the treatment plan to help lengthen tight muscles and increase the range of motion in the spine. Regular stretching can alleviate pressure on the herniated disc and surrounding nerves. Techniques such as yoga and Pilates-inspired exercises may be used to gently stretch and strengthen the muscles, promoting flexibility and better movement patterns. Correcting posture. Proper posture is crucial in managing and preventing further spinal issues. Physical therapists educate patients on the importance of maintaining good posture and teach them how to achieve it. This includes ergonomic advice for everyday activities, such as sitting, standing, and lifting. By learning the correct body mechanics, patients can avoid putting unnecessary strain on their spine, which can help reduce pain and prevent further herniations. Enhancing mobility. Mobility exercises are designed to help patients regain their range of motion and move more freely. Educating patients. Education is crucial in physical therapy. Therapists inform patients about their condition, recovery process, and symptom management. This includes lifestyle advice like maintaining a healthy weight, avoiding aggravating activities, and regular exercise. Educated patients can actively participate in their recovery, reducing dependency on medication. Physical therapy offers non-pharmacological methods for pain management, which can help reduce a patient's reliance on pain medications. Personalized treatment plans. Physical therapists develop individualized treatment plans based on each patient's unique condition and goals. These plans consider factors like the severity of the pain and symptoms, overall health, and activity levels. Personalized treatment ensures effective care and better outcomes. Preventing recurrence. Therapists help patients develop strategies such as ongoing exercise programs, good posture, proper body mechanics, and safe lifting techniques. Addressing root causes and implementing preventive measures promotes long-term spine health and reduces the risk of recurrence. Now I want to give you 7 important tips for herniated disc recovery. 1. Stay informed and patient. Understand that recovery takes time. Tissue healing is gradual, so be patient and trust the process, which can vary from weeks to months based on severity and individual factors. 2. Customize your treatment plan. Work with your healthcare provider to create a personalized plan tailored to your needs. Be open to exploring different treatment options and adjust your plan as necessary. 3. Embrace a multimodal approach. Combine various therapies like physical therapy and lifestyle changes. 4. Listen to your body. Pay attention to how your body responds to activities and treatments. Stay active with therapeutic exercises, but avoid activities that increase pain or discomfort. 5. Focus on pain management. Use various strategies such as medications, topical treatments, and relaxation techniques like meditation or deep breathing to manage pain. 6. Maintain a positive mindset. A positive outlook can significantly impact your recovery. Focus on progress even if small and surround yourself with supportive people. 7. Stay consistent with self-care. Self-care is crucial. Ensure adequate rest, a balanced diet, hydration, and engage in activities that bring joy and relaxation. Mental and emotional health is as important as physical recovery. Remember, every individual's journey with a herniated disc is unique, and there's no one-size-fits-all approach to treatment and recovery. By staying informed, being patient, and working closely with your healthcare team, you can optimize your chances of a positive outcome and improved quality of life. Don't forget to subscribe to the channel and leave a like. It would help me a lot to grow the channel. Also, let me know what topics you would like me to cover in the next videos in the comments. See you soon on the channel.